Hello and welcome to Sensei Podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei Podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello, everyone, and welcome to Sensei Podcast. It is my great pleasure to introduce Dr. Kate Kearney from University of Washington in Seattle, where she is the Associate Director of the Cath Lab and Assistant Professor to Medicine, and one of the best CTO operators in the US and internationally in a fairly short period of time, learning from some of the best as well. So, Kate, welcome, and thanks for being part of the Sensei Podcast.
Oh, thanks so much for having me. It's always good to be with you, Manos.
And this is about learning. So I'm just, you've done a phenomenal work learning the field and developing a high level of expertise. And that all happening in a very demanding environment because obviously your institution is very well known for CTO PCI, so the expectations, I'm sure, are very high. So how did that happen for you? How did this work? And what are the things you learned during the process?
Yeah, well, I mean, you have very kind words, but I have to say I really have an embarrassment of riches for just the environment that I was lucky to kind of fall into in training. So for me, the program actually changed dramatically with a few people you know well, but one being Bill Lombardi came down from Bellingham a few hours north of us and decided that, you know, at this stage of his career, he really wanted to focus on teaching and to make that, you know, his kind of next big thing, and that was really what was going to make him feel most fulfilled. And also in terms of changing the field and giving more access to patients, I think it seemed like a good fit at the time. So this cath lab here, you know, was busy, but with very different things. And it was largely driven by kind of the transplant program. And we did as many right heart caths and biopsies as we did PCI to some degree. It was a much smaller program. So he arrived, Mark Reisman came, Jamie McCabe arrived just before them, actually. And so just with some extra bodies and interests, I think things changed really quickly. So I was lucky that I was a first-year fellow when that all just happened, like right in front of me, and the place changed pretty quickly. And I knew I was interested in interventional, but had been, you know, a little bit shy about that. I was kind of trying to test the waters to see if I thought I would be any good or if I could gain enough skills that I should apply. And I was really kind of in that kind of mindset. And I just expressed some interest to them and they like shove you and they're like, go wire that thing. Okay. So I think for me and my personality, it just was actually a very good fit also that they were really encouraging, that if places where I would be very cautious and sort of second guessing if that was safe or if I knew what I was doing and would really hesitate, think, you know, they do a really great job of putting you in the right scenario and pushing you at that right moment. So at some time in April of my interventional training year, and, you know, as the program was just taking off, I was lucky that I was able to stay. But it was probably April of my first year of interventional training. And there was a CTO that I was able to scrub with Bill. And he basically made me stand there with the Compensa Pro 12. And he said, I'm not scrubbing in until you either perf or you wire it. And you can guess kind of which one happened because I had no idea what I was doing. But, you know, having watched a bunch of cases with him at that point, I think just those small moments of like, we're not going to follow it. You're not going to do anything. I want the wire to go somewhere. And just to feel that and kind of engage the cap and then be like, yep, that feels very free, but you can't trust it. And just some of those things of knowing where you are in your training and putting you through that. And I think as I've moved forward and trying to teach cases in sick patients or challenging lesions where, you know, I myself am not sure how we're going to complete the task. Sometimes I think back on that moment a lot of, you know, how can you take someone where they are and just put them in a place to try one little thing that's new. And I think that's actually very empowering. So that's kind of how it started. And I really had been interested in valve disease and done more research on that in general fellowship and thought those procedures were really exciting too. But then, you know, you sort of vote with your feet. And once we got further into that, just the thought process and the decision-making there just wasn't actually, it just sort of from the technical side, it just wasn't as natural for me. And what I really liked about CTOs or just focusing on these, if you just take all the garbage coronarias that kind of come to you and trying to figure out how to put that together, it's just not always CTO specific. But I think what I really liked about that was just focusing on those skill sets and a lot of the algorithms, that you and others have also really done a great job of facilitating that it's more about problem solving and sort of you go in with a plan A and a plan B and a plan C, et cetera. And then trying to anticipate some of the challenges, but realizing there will be some we weren't planning on at times too, and just engaging in the process that way. And I felt like that training was so valuable because it felt like it empowered me to tackle more things coming out of the gates, out of fellowship as well with that extra year. But just that focus kind of gives us more freedom to focus on the indication and the patient. And if we're not totally sure how we're going to get it done at the beginning of the case, that's just life. And so we'll sort of take our time and go through one step at a time. But you're right that I think the teaching environment is so important there because there's risks and it's real people and you're trying to figure out if I'm the right person and I have the right tools and the right environment in this particular scenario to try to take this on or not. And I think growing in that environment early career was really helpful because you can do a lot more when you have that support and feel like, it's reasonable. And if I reach this part of my algorithm, that's where I'm going to tap out and I can pass that on to someone else. So I think that's just huge. And it's unfortunately, not everyone's experience.
No, absolutely. And that's a unique position where obviously the teacher is so experienced and so confident that he can, pretty much troubleshoot everything. So it gives you a lot of leeway to get things done. Mm-hmm. But how did it actually feel when you were sitting by yourself for your first CTO with a super penetrating guide wire? And how did that feel? And then are you still feeling now the same kind of excitement? Probably not. But do you still feel some anxiety or stress before the procedures? How does it feel now?
Yeah, no, that's a really good reflection. I think then I was terrified because I was like, I don't know what to do next if this doesn't work. And I think that's really the most important key, right? And so now, and with the practice and training and all of that, I think what's great about these skill sets is they teach you a way of this is where you're going to push something, this is where you're going to try a penetrative wire, but then also how to manage it so that we don't get ourselves into trouble. So it's, when it's highly ambiguous, what are the other tools we can use to try to manage that if we're not sure we're in the right place or we think we do have a wire perf. And so before following that and making it a really dangerous scenario, how do we go from there? So the stepwise nature of it is certainly great. But I think the fun part about our lives is when you go in, you can think, oh, we have XYZ options, or I bet that septal will be great if we don't just wire it. And then sometimes that's just not how it goes. So I think that's the fun part about it. And from a teaching standpoint also, sort of you make a plan and then you sort of just deal with things as they come. So I think there's, for us in Seattle, I often reference it when we don't see Mount Rainier very often because it's often gray and pretty cloudy and all of that. And even the summer, it can be hazy. And when the mountain's out, it's like every time I'm like, wow, that's so amazing. And it looks so great. And so it sort of feels like that with CTOs every time too. It's like, especially if we have to do some technique that we've practiced, like using a Stingray or when you complete reverse cart. And I think over time, there's the cases that feel more straightforward. But that's where teaching, I think, still makes it so exciting too, is that it's still always an adventure for someone at the table. But, honestly, these things are still really satisfying when they play out and kind of working through the problem solving and the persistence through that. If it's able to come together, I think that's just really rewarding still. I am still nervous before cases. That's 100% true. But,
Well, and I think, many people have said the same thing, that it does, even very experienced people, you still want to have a cautious level of stress, because if you're completely relaxed, sometimes you may not focus as much as you want. How do you manage to focus? As you said, those cases can be very unpredictable and many things can happen. How do you keep your focus and persistence during the case?
Yeah, that is one thing I've had to work on. Certainly early on, you're just so focused on one aspect of the case, you can lose track of time or contrast or, radiation and all that other stuff going on. And so I think that is part of that maturation process of, so we use the timers fairly often actually. And so if it's like, okay, I thought this would work, and I really wanted to base power knuckle and do stinger in this case because I'm trying to work on that. But when you're 20 minutes in and you're not moving along, it's sort of that kind of threshold of, okay, I can always come back to this, so it's time to move on. And I do think that does help me. And so just to keep kind of a more bandwidth and have more purview of where we're at in the case. So for me, when Bill took a kind of mini sabbatical and was gone for 3 months, that was a good chance for me to sort of try to tackle things that I thought, I had a plan, but it was the type of case where it's an inpatient transferring in for whatever reason, we're trying to get this done and not exactly the perfect time setup or something like that. And working through that. And I think you have to put some barriers to make sure it's a reasonable situation. But with some of those, we're like, okay, I think I can try, and I may not be successful, but I have several plans there that were worth a shot. And I'm sure it took me twice as long as it would in some of those cases. But a big piece of that was, okay, I'm going to try this, like set the timer for 5 minutes. And usually 5 minutes hits and you're like, okay, just a little longer. But I think that kept me on track for a lot of those where it's just tempting to get a little frustrated, a little fixated. And if I didn't really like the next part of the algorithm, then of course, like I'm going to push that further and further away if I don't have something else to keep me honest. So I think that helps a lot just to stay focused. And then honestly, it's our whole team is just such a huge part of that. So there's many times you're so focused on something that you'll miss the retrograde guide pressures damp or things like that. And so I think just having the whole crew and trying to empower them to speak up, and occasionally it's an interruption that, it's like, okay, I know that's fine. But that way I think it's a lot safer. You just have multiple eyes looking out for you. So they're a huge support because our team has a lot of experience. And even the folks that are less experienced, I think are really interested and engaged. And so that's been a fun part of that too. But was a huge asset for me staying on here after training.
And then do you actually have a timer, or you use the X-ray machine timer, or how do you do this for the timer?
Yeah,
that's something I haven't heard from other people.
No, that's true. Yeah, we'll have the person who's monitoring can put up the timer up there. And so actually in one of those cases when, it was like the third one of the day and I'm sort of losing some confidence in this post-cabbage case, one of those where we're up the graft retrograde and we can't figure out antegrade, and it looks like you're so close, but you're in the graft and you're actually not close. And I'm getting frustrated. And I was like, okay, I'm going to try this thing for whatever, put up a timer just to keep me honest. And one of our techs, her name's Sydney at the time, she actually labeled it. So it's up there on your fluoro screen that you're working. It's up there in the corner, or it'll be over, near the vitals and the hemodynamics. And she actually put the label on it. It was like, you're doing great, sweetie. So it's really, I saw that at some point in the middle. It made me laugh. So I think speaks to both of those things of how the staff support us. But yeah, we'll actually put it up there because then you hit that and it's like, okay, if I'm trying that hard at one thing, and I look back, those are the cases I got into trouble. It was like, I really thought I could wire it, and you just keep trying to wire it or something, and you end up being in a wrong branch or something, or it gets more dangerous. So I think it's important for a number of levels, but as a junior person trying to figure out the tempo of that, of how long do I try, might be different than for you or Bill. So I think there's an aspect to that. It kind of puts it in a more tangible bucket of like, okay, that's a reasonable amount of time to try that strategy. And then if I can't do it, then it's time to try something else.
And how do you deal with, complications happen to everyone all the time, but how do you deal with these specific techniques? Do you talk with Bill? Do you review? How do you deal with the complications?
Yeah, as it's such a huge part of our world. And I think, again, a really important aspect of empowering people to take on more of these cases, especially earlier in your career. So overall, the first perf that I had to coil was a horrible mistake. I followed a Mongo that looked so free, but it was free out end of a branch into the pericardium. It was a circ, and I got a little confused with the landmarks, obviously, and didn't have good visualization. And I took a balloon over that, made a giant hole, and was one of those things where when I took the puff right after, I thought for sure it was a fistula because I couldn't believe he wasn't crashing and burning otherwise. We put the balloon up right away. And I had an 8-French guide, so basically could kind of pseudo ping pong, like got the microcatheter and delivered the coils and took care of it. And I think that day Bill was in clinic and I was maybe 3 or 4 months in or something like that. And by the time he got down, he was like, well, I'm really proud of you that you coiled this before, like without even having any effusion to tap. But also, like, here are the mental errors that you made to get there. And I think those are when I'm talking to the fellows now, like I can't prevent you from ever making a mistake. And I obviously made one in that case. It took quite a while before I could show that case actually in talks and things like that. I was just so embarrassed by it because in hindsight, it seemed very obvious to me. But I think the empowering part is if I can manage him, and it was fortunately the perfect scenario to do something like that. He was actually being referred for transplant for refractory angina. So if this tiny branch that we couldn't see that had previously been stented, if that is coiled, there's probably not the same clinical consequence. We're just trying to get his angina to go away. So we're like, maybe that'll do it. But, and he had a couple other lesions to treat as well. But I think what we did do is go through all the kind of judgment pieces of that. I wasn't prepared for that because we didn't have the old films that showed that territory. We only had them for the RCA. So for the right, I had this plan and sequence of events and all the rationale for what we were doing. And this was like, oh, it went so well, let's try this. And if we can start, get a knuckle wire in and do an investment procedure, then great. And he's just so desperate and in the ER all the time. I felt like motivated to try that. So I think like while the intention and the indication were reasonable, a lot of the other judgment was not. And so then it's like, I'm not as prepared. We didn't have the old films because they weren't, they didn't transfer, unfortunately, where that showed that prior territory when it was open. So I didn't have very good landmarks. There's poor visualization. And then again, in hindsight, I think it's not a course that I would expect. And I had wired, not knuckled. There's all these factors there that I trusted something, kind of hoping it was right rather than doing the other safety checks. And so that was a really important case to sort of learn and go through. And that's where I think that people struggle, is who can you safely show that to without maybe totally ruining your reputation or feeling like no one will ever let you do PCI again. I think unfortunately we're all going to make a mistake at some point, or at least have some complication present, even more commonly, especially with perforations in our world. Sometimes you can do everything. We can't find a technical thing that would have prevented it, but we do have to be able to manage it. But we go through them as a team. Certainly, I think kind of at conferences, and I've been working with folks like you on some of the courses we do is great because you get these little nuanced views of someone else with a slightly different style too. So for me, that's great. But I think reviewing with someone who's experienced and has dealt with that before. And unfortunately for many people, that's probably not the person in the lab next door to them, because you might have different practices or an experience. So I think that's where more of, these Zoom share things have actually been great. There's lots of people will do that with bidirectionally of like kind of sharing cases, and these smaller angio clubs and complications are a great way to do that in a smaller group with people you trust and can talk through that. Because, I always tell people I think if you have a complication and whether they manage okay or not, if you don't learn from it, you're not honoring the patient or the complication or anything that happened. But if you take something away from that, and even more so if you can teach other people that will avoid that, I think that does honor kind of the situation and gives you a chance to and other people to grow from that. So I think that was my kind of worst case example, where it's like, what was I thinking? But if you go back through, it's like you can see the sequence of steps that led to that. And that's much easier to change than to say, well, don't wire the wrong place. I think that's, there's going to be other situations where I might do that, but I won't make the next judgments, hopefully, that led to that problem. So yeah, it's a huge part of it. As you know, we run a whole weekend course that's just sort of focused on that, because I think there's so many aspects to it. There's the emotions of it immediately after. You have to manage those and just keep working. The fellow, one of our recent fellows, Katie Dawson, was there in my kind of early practice, was part of her training period too. And so at that moment, I was certainly probably not as confident in managing them as I am now, but it's always an event, but emotionally. But at that point, she said something to the effect of like, you're always so calm when these things happen. And I was like, the fact you said always means I've had too many of these, but we'd had 1 or 2 cases over the course of those few months. And I think part of it is I'm so like, internally you have all these emotions. You're like angry, or like, why did I do that? Or that was dumb, or you're scared and you're afraid for the patient, or you're thinking of the conversation you had with them and their family. But you kind of have to channel all that as that tunnel vision starts. You just have to channel that out. And I think kind of thinking through these things ahead of time of what are some of the potential complications, and kind of that mental rehearsal piece, much more like for performance sports or things like that, of like, these are the steps. And if you're going to take on a higher risk case, I sort of think up front, if I have a perf here, how am I going to manage that? And I think that makes it a completely different scenario when it happens, even if it's pretty infrequent. You kind of go to your plan first. You like remember your training, as opposed to those emotions sort of overtaking everything. And, that next mistake or an error, losing the guide, those types of things are always can be catastrophic in those cases, and are always a battle too. So I think that really helps, just to have the very next step in plan, and then you can kind of get into the motion and managing things.
Yeah, no, I mean, that's perfect overview. And I think you're right. We do get direct feedback for the case itself, right? The preparation is hard to miss. I mean, it's there. But then it's one thing to know why it happened, but it's another thing to know why it happened and what can you do to prevent it. And that's where the more experienced people, as you say, can really help a lot, or any colleague for that matter can give you an opinion and help, as you say, make the most out of whatever happened. Now, in terms of growth, how do you learn now? Are there any specific things you do apart from doing a lot of cases as you do, talking to people? What are the things you think for keep on growing versus staying the same?
Yeah, no, it's true. And I feel like someone recently called me mid-career, and I was like, am I that old? But I think it is an important thing as you go through that, of like in the very beginning, you're just trying to get traction, hone those skill sets and translate what you've learned to doing it on your own. And then, that's still a process, obviously, to some degree in certain cases, but I think taking that to the next level, how do I keep growing? How do you refresh the skill sets and keep things moving forward? So, we talk a lot about purposeful practice. That's kind of one of the buzzwords that Bill likes, but I do really value that, because when you're focused on, I'm going to be a better operator, that's so loose. It's like, how do I hold myself accountable to that? How do we focus that in a way that's actually tangible and will actually work? And so instead, it's, I'm looking for good stingray cases to increase my confidence there on challenging ones. So I want to practice that, is for ADR. So then you sort of, part of the case selection plan is, I don't think ADR will work here necessarily, or it's not a very good target, and the visualization is challenging, or the angles, or whatever it is. But there's some rationale to do it, and it's safe and reasonable there. And if find ourselves subintimal, and I'm not worried about hematoma issues changing your next option, you sort of pick a case where if it works, that will be very effective, and if it doesn't, I still have other options. And it's, again, that sort of time limited trial of, I think, just that practice and going through the steps, and then reviewing with other people who are better at it than me, of like, okay, how would you have done that differently? Or, the small decisions of, did you balloon, or how is the hematoma management? And if you have to balloon because it didn't deliver, would you move it here? Or how do you choose that location? I think then you can get feedback after the fact from folks who have really dialed in on that, or, had to get it in cases where that's the only option. So I think that's still very valuable. And then the other is just getting out, I've had a great environment to train and to grow in, but it's still one place and one style and one environment. So I think getting to see other cases, I think things like live cases are so great that way. You just see kind of someone's whole practice. I know there's some of it is a little bit different than their day to day, but overall you see how everyone does everything in the lab outside of your own institution. So that's really great. And then, and traveling and things like CTO Plus, and seeing a variety of things and courses and all of that. And then, I think another important thing is we just had a new partner join us a few months ago, Lorenzo Azzolini, as you know. And so since he didn't train here, and he has slightly different styles and plans and things like that, in a lot of the cases, I think that's also been really great to have someone that didn't just train in this pathway in this institution come in, and then that shakes things up a little bit. You're like, oh, I don't usually go to that right away. And then we can have discourse and sort of think about it in this scenario versus that scenario, and learn a lot from each other that way. So I think kind of it boils down to like that purposeful practice of what am I going to focus on? And then as that starts to get easier, what's going to be the next thing? Because that has to be a moving target always. And usually in a couple arenas, there's certain things for teaching that I'm focused on. There's certain things for CTOs I'm focused on. There's certain things for managing the cath lab that you're focused on. You kind of have to have a few benchmarks, I think, to hold us accountable. And then the other is just getting outside of your comfort zone at home, and seeing what other people do.
Then do you have a checklist of the things you want to work on, or is this something that you just periodically think about?
Yeah, I have a whiteboard that I won't show you because my to-do list is embarrassing, but that right here. And I think actually put it there, it's sort of like, that paper or this review or whatever. And then on the other side are some of those things. One thing Benita Shah said to me once, which I thought was really good, is to sort of schedule it on your calendar every 6 months of, overall for your professional development. What are the things that I want to prioritize? How does that look like with what I'm actually doing with time management and things, and what's reasonable there because it's a means to an end, and what are things that I should actually use to promote someone else or to pass on or, use as a sponsorship event actually, because that's not part of my focus, and looking for those opportunities. And I think it sort of comes back from the professional side. And recently, Lorenzo had suggested that we meet once a week to review tough cases. And we sort of were talking about that. It sounds great. All of our failures and complications we can go through in more detail than, just kind of the larger group. But also to use some of that time in and out of the hospital of our overall planning. So it's like, okay, and that way, if you say it out loud to someone else, I think it will hold you accountable too. So I think that's where having a partner in the CTO program, whether that's at your site or elsewhere, is really helpful to have those check-ins and review cases. But part of that, I think, is to just you say it out loud or write it down somewhere, because that makes it more real.
Perfect advice for everyone. And in terms of the fellows you choose, you have a lot of people who want to train with you. What should they do to be selected?
Yeah, that's always a fun time. I wish we could have more people come through the program, but it's true. It's you put a lot of intensive time in, and we want to make sure that the training is valuable to folks who come out. But I think the folks who have done best in our program, honestly, are just very good doctors, and they're very good cardiologists, and they've really gone through that, because a lot of the technical stuff is different, and it's a very different experience to just do it day in and day out. And we can get 90% of people, if not 99% of people, I think, can pick up that aspect of things. It's more the decision-making, sort of the complexity of here's this horribly sick person in a tough situation, and how do we decide what to do in the order of operations and that. So I think that's where, honestly, your good basic cardiology training really does go a long way. And that really helps people succeed here. And part of that is, if you can manage that, then I can focus on just managing the procedure, which includes teaching and how to do that, even if someone's quite ill, and be effective in teaching and letting you do the parts that will not change the case pattern and all of that. So I think that frees us up quite a bit there. And then the other is to just get exposure to lots of different things. So because I do think it helps it's a little hard. You're 4 or 6 months in. It's like, oh, do you want to do CTO training or structural training? And what have you seen? So I think the more exposure people have to all aspects of that, that just helps kind of coming in to have a better sense, because it's a little overwhelming to see all of that and then kind of have to choose a pathway. And I think overall, we're probably best as a 2-year program just because of that. In the beginning, the first few months, it's like, wow, everything is so hard, and we don't have enough cases that we can really have you do start to finish at that stage. But honestly, by the end of the year, all of those things are second nature, and I think it works out. And then that second year is really great at honing in on a subspecialty skill set to a degree, but also just kind of that maturation process of managing the room and your decision workflow so you're efficient, and all those things that I think really help just people tackle more coming out after that second year.
What excites you the most right now? You've done a lot of things already, but what is the most exciting thing?
That's a good question. I do think, talking about teaching, for the most exciting thing is something that I know is challenging, and you see somebody do something now that they couldn't do 2 months ago or something. It's like the very clear leaps are actually really, that's just really rewarding for everybody. So I think that's part of it. It's like medicine is certainly a team sport, but that's like, those are the cases. There's cases where I'm really excited about something, but like half the room had no idea why I thought it was going to be hard, or what technical aspect I'm pumped about. They're like, whatever, we're done. Like, that didn't seem exciting. Nothing happened. So I think there's some variation there. But whereas like seeing somebody learn and take like a big leap like that, like the whole team can feel that. And I think that's really exciting. And it's neat that I think the patients are pretty engaged in that too. Like they're often very proud of the fellows, I think, realizing like where they are and how much work they put in. And, they, even though they're pretty sleepy, I think they have a sense of how engaged they are. And so if they did their first reverse cart and we're like, go tell them you did it, that's great. And I think the whole crew is just really pumped about that. I think that makes it the best.
And what is your favorite book and your favorite movie?
Oh, I saw that on the list. I didn't think about that very well. Let's see.
If you have one.
Off the top of my head, yeah, for sure. The book I've probably reread through different parts of my life is actually All Creatures Great and Small by James Harry. He was like a country bumpkin veterinarian, actually. But just, I think some of the emotions, like reading it now as an adult, I loved animals. I thought I wanted to be a vet at some point, and then I was like, that job's too hard. So we did this. But I think the stories are funny because a lot of them are that, type 2 fun, a little bit of like, what are you doing out in the middle? They're in the cold trying to deal with a cow or something. But it's a little bit of like that persistence and the investment, and also some humor, I think, in all of that and the relationships around it. So it's funny, like as a kid, I liked it for totally different reasons than the last time I read it. So it's probably one of the rare books I've actually reread. So that's probably one. And let's see, my favorite movie is probably The Princess Bride, but probably for similar reasons, that there's a few movies that I would rewatch, but that's kind of a family cult classic. And I think there's some good moments there that we reference back to. But.
Perfect. And then what is next for you? What are the next things that you want to do?
Yeah, I think the biggest piece for me is trying to, grow more independence in some of the things that I know. It's like there's a part of a procedure or a certain epicardial. I'm like, I wouldn't do that. Like Bill might, but I'm not going to do that. And I think what we talk about is looking forward of like, how do we have a plan where, Lorenzo and I are doing those cases when he's not here and as safely as possible. And like you sort of having a trajectory to get there, because there just are those cases where, we've tried the usual things and we're at that last part and we feel like that's warranted. And so trying to work on those. So, some of it's sort of the specific technical things like that. Like for me, that's certain epicardials and stingray are like kind of the things that I think I tap out on the tougher cases sometimes from that aspect. But I think big picture wise, it's really more about managing this for a lifetime. It's so exciting in training. You're like drinking from the fire hose, and the first few years, it's like you can hustle and there's no limit. But I'm starting to feel that. I went a few months without running after I moved, and then my body fell apart and everything was a mess. And it's like, oh gosh, now I'm just doing PT to get back to all that. So I think having that more realistic long-term outlook of how do we make this sustainable? There's a lot of emotional aspects about our job. There's the physical aspects. There's the time management pieces. And trying to do that in a way where, we're productive, but can maintain kind of multiple aspects of things, including kind of the team and everything else that goes with it.
So how do you keep fit, since you brought it up? Are you exercising? Are you doing any yoga, meditation, or other things that keep you balance?
Not enough. I'm like everybody else who's like, okay, January, I'm going to get back on. But yeah, I think, when I look back, there's certain blips. I dislocated my elbow snowboarding, actually, which was an activity that I found very good mentally, just really disconnect when you're out there because you're so focused. But I lost my focus, I guess, one moment and kind of just fell on scooting down the side and hit an ice rock and dislocated that. So that sort of was like a cascade of things of realizing when I came back, I was so focused on, I thought I'd be really productive. I really just was so focused on PT. That's like all I did to get my hand function back, which fortunately worked. But at the same time, I think there's all those things like then I wasn't really exercising, and coming back from that, I so focused on getting back through work and kind of holding on the fort while Bill was away that, you come out of that realizing like, I need to get back on it. So I am doing all my PT so that I'm like running very low mileage, but just getting back into that. And then biking is another thing that has been good for me. I think what I've realized is the flip side, especially with us and the days we're wearing lead, and some of that we fortunately don't always have to, but I do feel that more. So I think for the other aspects of that, like yoga, and then for me, meditation, like before sleep, has been really valuable to like turn off the day, kind of stop thinking about that case for tomorrow. And those routines have actually been really helpful for me, but weren't something I did, I think, until a couple of years ago.
And then what are you most proud of?
I guess it's probably that summer actually that that Bill was gone. And part of it was because I really screwed the pooch by dislocating my elbow right before that. So I was effectively couldn't cath for like 4 months mostly. I was doing a couple of right heart caths by the end of that. That was about it, just to get my dexterity back. And I think coming out of that and having kind of a short window, and then while he was gone, it was sort of like, okay, I know I've done this. I've been out a couple of years. I have no excuse. Like I'm gonna hold down the fort and just do what I can. And I think, he always has a plan. So to some degree, that was very helpful. That it wasn't like this just came out of nowhere. It was the right time, aside from my elbow dislocation. But I think just that was important for me, honestly, to build confidence. I think coming off the injury too, there was a lot of uncertainty. It felt like going into it, but I think managing that and working with the team and sort of owning more aspects of team management and some of the administrative things as well. I think that's probably when I look back, that was one of the biggest jumps and something I was most afraid of. So that's probably a good one.
And then to finish it up, what would you advise people who want to do what you did? Go and learn and become super good at doing complexity or PCI. What would you be your pearls of wisdom?
Yeah, that's a good one. I think, the biggest aspects of all of this are what drives you there in the first place. And so if you're just like, oh, that sounds cool and exciting, and you have to pick something, I think it'll get tough along the way. I think for most people, what really drives them is they're really frustrated when the patient doesn't have an option that, for whatever reason, surgery isn't a good option, and just like throw up our hands and there's nothing we can do. Whereas, someone with your skill set actually can offer them options. And so if that's what drives you, then I think this never gets old, and you can roll with, the emotional days of a complication or a case. It's harder to fail. If you always pick cases, you'll be successful in it. It'll look pretty at the end. That's a very different classification. So, but I think if what drives you is that improvement and trying to treat the people who have no options, I think that you'll do well. And then what it really comes down to is finding a training environment that can support that. And for some people, I was really lucky I was able to do that in kind of a structured way. But for many people, that is actually just reaching out at a meeting, and, people I've met at your meeting or other places who are neighbors, and we can connect. And I think that collaboration is so important to actually gaining that skill set, regardless of whether you do a dedicated fellowship. And I think the advantage of that is just it condenses a lot of the more technical things and some of the other leadership and management aspects of seeing someone run a program and then taking that out on your own. So I think there's some advantages to that. But no matter what, probably the most important piece is having that community.
Wonderful. Well, Katie, again, you've done a phenomenal work on building on a already superb program and making it even better, and teaching many other people, and also serving as a role model for other women as well, which there are not still as many in the field. Really appreciate for all your thoughts and comments, and many people will do the same. Thank you so much, and excited to keep on working with you on multiple projects.
Sure. Well, you've done more than anybody for, I think, the field of CTO and especially teaching. So many thanks to you for that, but it's been great to be here today.
Thank you for listening to the Sensei podcast.